couple of seconds to get out of the room here. Men's health specialists say the risk of a certain injury goes up heading into Valentine's Day. Medical reporter Liz Bonis shares why it's important to seek medical attention for this right away.
Hey there, hello to you. This injury, not the usual concern that brings people into the emergency room, but a new study, one of the first to show that the risk for this painful problem is higher for guys when romance is in the air. Researchers found that romance may be linked to an intimate injury. After tracking hospital stays for more than 3,000 men for 15 years, they found when they looked at days of the week and months of the year, there was a 1.2% rise in penile fractures around romantic holidays such as Christmas.
But they also found this on weekends and summertime. So think times where sexual activity may be something that people partake in a little more, there's going to be a higher risk of penile fracture.
The fracture itself, he says, is not a true break, but rather likely a rupture of the lining, which can lead to blood in the urine. It sometimes needs a repair or a rebuild to make sure the blood flow stays in the proper space. Dr. Paurush Babbar of Ohio's Urology group says this most recent study is likely to be a low estimate.
We in the United States think that it's between 1 in 100,000 to 200,000 men will experience a penile fracture. And certainly I think that's underreported, because many men will, due to embarrassment, not go in and ride it out at home, which is not the right thing to do.
So what makes that not the right thing to do? Don't these heal on their own?
Yeah, so I think generally, it will heal, but will it heal correctly, right? So that's what it comes in. I don't think it will heal correctly. A lot of times what I see patients who have had, like a very, let's say, minor penile fracture who ride it out at home, they come in with either erectile dysfunction, okay, or they get scar tissue in the area of the penile fracture, and then that creates deformities to the penis, whether that's curvature, which precludes intercourse, or they can get what we call hourglass deformities, where there's a narrow waist there. And so it's better to have a true penile fracture looked at in a semi-urgent fashion, and then have a urologist go in and evaluate and correct it at that time.
It usually takes about 6 weeks to heal, Dr. Babbar says, if you do need a surgical repair or procedure. With your health news, I'm Liz Bonis reporting.